Hey everyone, it's Shivam. Life is unpredictable, right? One minute you're having a great time with friends at a barbecue, and the next, someone cuts their hand while chopping vegetables. Or you're at the park, and a child takes a tumble off the swings. Accidents, big and small, are an unfortunate but very real part of our daily lives. They can happen in a split second, anytime, anywhere, and often when we least expect them. It's in these critical moments that a little bit of knowledge can go a very, very long way. That's where you come in. You might not be a doctor or a paramedic, but you can absolutely be the person who makes a life-saving difference. Knowing just a few basic first aid techniques can change the entire outcome of an emergency. It's about more than just having a first aid kit. It's about having the confidence and the skills to act decisively when someone is hurt or in distress. Being prepared isn't about being paranoid. It's about being empowered to help those around you, whether they're family, friends, or even a stranger. So today, we're going to break it all down. I'm going to walk you through 5 incredibly important, yet simple first aid skills that everyone should know. We're not getting into complex medical jargon or procedures. This is about practical, essential steps you can take to manage common emergencies until professional help arrives. By the end of this video, you'll feel more confident and prepared to be the hero in a situation that truly matters. Let's get into it. Alright, let's start with something we've all experienced, a minor cut. Whether it's a paper cut at the office or a slip of the knife in the kitchen, it happens. Your first instinct might be to panic a little, especially if there's blood. But the key is to stay calm and follow 3 simple steps: clean, pressure, and cover. The very first thing you want to do is wash your hands thoroughly with soap and water before you even think about touching the wound. This is crucial because it prevents you from introducing bacteria and causing a nasty infection. Once your hands are clean, you need to clean the cut itself. Gently rinse the area with cool running water to clear out any dirt or debris. You can use a mild soap around the wound, but try not to get soap directly inside the cut as it can cause irritation. Now let's talk about stopping the bleeding. For most minor cuts, this is straightforward. Take a clean cloth, a sterile gauze pad, or even a tissue if that's all you have, and apply gentle but firm pressure directly onto the wound. Don't be tempted to keep lifting it up every few seconds to check if it's stopped. You need to maintain that continuous pressure for at least a few minutes. This simple action helps the blood to clot, which is your body's natural way of sealing the wound. If blood soaks through the cloth, don't remove it. Just add another layer on top and keep applying pressure. Removing the first layer could disrupt the clot that's beginning to form, and you'll have to start all over again. Once the bleeding has stopped or slowed to a trickle, it's time to protect the area while it heals. This is where the bandage comes in. After gently patting the area dry with a clean cloth, apply a sterile adhesive bandage. Make sure the adhesive part sticks to the skin and the non-stick pad is directly over the cut to protect it from friction, bacteria, and further injury. For a slightly larger cut, you might use a piece of sterile gauze held in place with medical tape. The goal is to keep the wound clean and covered. Remember to change the bandage daily or anytime it gets wet or dirty to keep the healing environment as clean as possible. And that's it. You've just properly managed a minor cut. Next up, let's talk about burns. We've all been there, accidentally touching a hot pan, getting splashed by boiling water, or maybe spending a bit too much time in the sun without sunscreen. The immediate sensation is intense, and your first move is critical for minimizing the damage. The #1 rule is to cool the burn and cool it quickly. As soon as possible, get the affected area under cool running water. Not cold, and definitely not ice water. Just cool tap water. You want to keep it there for at least 10 to 20 minutes. This does 2 important things. It helps to relieve the pain, and more importantly, it continues to draw the heat out of the skin, preventing the burn from getting deeper and causing more damage. A common mistake people make is reaching for home remedies like butter, oil, or thick creams. Please do not do this. These substances can actually trap the heat in the skin, making the burn worse, and they can increase the risk of infection. Another big no-no is using ice or ice packs directly on the burn. The extreme cold from ice can cause further damage to the already delicate burn tissue, almost like a frostbite on top of a burn. So let's keep it simple and effective. Cool running water is your best friend. If running water isn't available, a cool, clean, wet cloth or compress will also work. Just be sure to keep it cool by re-wetting it frequently. After you've thoroughly cooled the burn for a good 10 to 20 minutes, you need to protect it. Gently pat the surrounding area dry, but avoid rubbing the burn itself. Then, cover the burn loosely with a sterile non-stick dressing or a clean cloth. The key word here is loosely. You don't want to put any pressure on the sensitive skin. This covering helps protect the area from the air, which can reduce pain, and it shields the blistered or raw skin from bacteria. If blisters form, do not pop them. Those blisters are a natural, sterile barrier your body creates to protect the underlying skin while it heals. Popping them just opens the door for infection. For minor burns, these steps are usually all you need. Okay, let's tackle one of the most common and sometimes dramatic-looking first aid situations, the nosebleed. They can happen for all sorts of reasons. Dry air, picking your nose, a minor injury, and while they can look alarming, they are usually very easy to manage if you know the right technique. The most important thing to remember is to lean forward, not back. I know, our instinct is to tilt our head back to stop the blood from dripping out the front, but this is exactly what you should do. Tilting your head back will cause the blood to run down the back of your throat. This can lead to you swallowing it, which can irritate your stomach and cause nausea or vomiting. In some cases, it can even go down the wrong pipe and pose a choking risk. So, always sit down and lean forward. With your body positioned correctly, sitting up and leaning forward, the next step is to apply direct pressure. Using your thumb and index finger, firmly pinch the soft, fleshy part of your nose, just below the hard, bony bridge. You need to pinch both nostrils closed, even if the bleeding is only coming from one side. And here's the key. You need to breathe through your mouth while you're doing this. It might feel a little awkward, but it's essential. Maintain this firm pressure continuously for at least 10 to 15 minutes. Just like with a cut, resist the urge to release the pressure to check if the bleeding has stopped. You need to give the blood vessels enough time to clot properly. After 10 to 15 minutes of continuous pressure, you can gently release your fingers. The bleeding should have stopped. For the next few hours, it's really important to avoid doing anything that could restart it. That means no blowing your nose, no picking your nose, and try not to bend over or do any heavy lifting. You want to keep your head higher than the level of your heart to reduce blood pressure in the veins of your nose. If the bleeding is very heavy, or if it doesn't stop after about 20 minutes of continuous pressure, that's when it's time to seek medical attention. But for the vast majority of simple nosebleeds, the lean forward and pinch method will take care of it perfectly. Now we're moving into situations that can be genuinely frightening, choking and fainting. Let's start with choking. This happens when someone's airway is blocked and they can't breathe. The universal sign for choking is when a person clutches their throat with one or both hands. If you see this, first ask them, are you choking? If they can speak, cough or breathe at all, encourage them to keep coughing forcefully. A strong cough is the most effective way to clear an airway. But if they can't speak, are making high-pitched noises or are turning blue, you need to act immediately. This is when you perform the Heimlich maneuver, also known as abdominal thrusts. To perform the Heimlich maneuver, stand behind the person and wrap your arms around their waist. If they're standing, you may need to position one of your legs between theirs for better balance. Make a fist with one hand and place the thumb side of your fist against their abdomen, slightly above their navel and well below the breastbone. Grasp your fist with your other hand and deliver a quick upward thrust into their abdomen, as if you're trying to lift them up. Perform these thrusts in a continuous series until the object is forced out and the person can breathe, or until they become unresponsive. It's a forceful and direct action, but it's designed to use the air trapped in the lungs to push the object out. Now, what if someone faints or becomes unresponsive? Fainting is a brief loss of consciousness, often due to a temporary drop in blood flow to the brain. If you see someone collapse, your first step is to check for responsiveness. Gently tap their shoulders and shout, "Are you okay? Can you hear me?" If they don't respond, immediately call for emergency help or tell someone specific to call 911. While you wait, check if they are breathing. Look for the rise and fall of their chest. If they are breathing, gently roll them onto their side into the recovery position. If they are lying on their back and breathing, and you don't suspect a neck or spine injury, you can help improve blood flow to the brain by carefully elevating their legs about 12 inches off the ground. Do not give them anything to eat or drink. The main goal is to keep them safe and maintain their airway until they regain consciousness or help arrives. We've arrived at arguably the most critical skill we'll discuss today: cardiopulmonary resuscitation, or CPR. When someone collapses from sudden cardiac arrest, their heart has stopped beating effectively, and blood is no longer flowing to the brain and other vital organs. Acting in these first few minutes can literally be the difference between life and death. The first and most important step, before you do anything else, is to ensure the scene is safe for you to approach. Then, check for responsiveness. If the person is unresponsive and not breathing, or only gasping for air, you need to call for emergency medical services immediately. If you're alone, put your phone on speaker so you can talk to the dispatcher while you begin CPR. If someone else is with you, point directly at them and say, "You, call 911 and get an AED if you can." Being direct is key in a chaotic situation. Once help is on the way, you need to start chest compressions. This is the core of hands-only CPR, which is what we are focusing on today because it's effective and easy for anyone to learn. Position the person on their back on a firm, flat surface. Kneel beside their chest and place the heel of one of your hands on the center of their chest, right on the breastbone between the nipples. Place your other hand on top of the first and interlock your fingers. With your arms straight and your shoulders positioned directly over your hands, you're going to push hard and fast. The hard part means compressing the chest at least 2 inches deep. The fast part means doing it at a rate of 100 to 120 compressions per minute. So how do you keep that rhythm? A great trick is to think of a song with the right tempo. Songs like "Stayin' Alive" by the Bee Gees, another one "Bites the Dust" by Queen, or even "Baby Shark" all have a beat in that 100 to 120 per minute range. It might sound silly, but it works. And it can help you maintain the proper speed when you're under pressure. You need to continue these compressions without interruption. Don't stop. Keep pushing hard and fast in the center of the chest until you see obvious signs of life. An AED becomes available and is ready to use. Another trained responder or EMS personnel take over, or you become too exhausted to continue. It's physically demanding, but every single compression you give is helping to pump life-sustaining blood to that person's brain. You are their lifeline. And there you have it. Treating cuts and burns, stopping a nosebleed, responding to choking, and performing the basics of CPR. These aren't complicated medical procedures. They are simple, powerful actions that anyone can learn. The knowledge you've gained today empowers you to step up in an emergency instead of standing by, feeling helpless. Remember that in a critical situation, doing something is almost always better than doing nothing. The person who provides that initial care, who cools that burn, who applies that pressure, who starts those chest compressions, is building a vital bridge to survival until professional help can take over. I truly believe that first aid is a fundamental life skill, just like learning to swim. You hope you never have to use it, but you'll be incredibly grateful you know how if the need ever arises. So my challenge to you is this: don't let this knowledge just stay in your head. Practice it. Talk about it with your family and friends. Share this video with them. The more people in our community who know these basic steps, the safer we all become. Imagine the impact if everyone in your circle knew how to be a first responder in those crucial first few minutes. Thank you so much for watching and for taking this important step toward being prepared. You now have the tools to be a hero when it matters most. Stay safe, stay healthy, and I'll catch you on the next video.